Hi, I'm Sydney Rollinger. This is my head to toe. Here's my head to toe clear, clean, blank sheet. Okay, I'm setting it over here. Hi, I'm Sydney. I'm going to be your student nurse today. Can you tell me your name and birthday?
Caitlin Duffing, July 19th, 2001.
Alright, any allergies?
Nope.
Alright, good deal. So I'm going to give you a head to toe today. So it's just like a full body assessment kind of thing. But is that okay with you?
Mm-hmm.
Alright, I'm going to start out with some questions first.
Okay.
Alright, so what state are we in?
Michigan.
Alright, what year is it?
2022.
Okay, good deal. And do you have any previous diagnoses?
No.
Alright, any previous surgeries?
No.
Alrighty. What medications are you currently on?
Birth control.
Alright, and why are you taking that? Why did you start taking it?
For my acne.
Okay, and then has it changed your periods at all?
No, they're really regular.
Okay.
Every month.
And then are you sexually active?
Yes.
Alright, and are you using some other form of contraceptive as well with your birth control to keep you safe from STDs and stuff like that?
Yeah, I use condoms.
Alright, and your periods are regular?
Mm-hmm.
And any side effects of your birth control or anything like that?
Nope.
Alright, and how long have you been on it?
About 3 years.
Alright, good deal. And then how often do you smoke?
I don't smoke.
Okay, how often do you drink?
I don't. I'm not old enough.
How often do you use street drugs?
Never.
Alright, can you tell me a little bit about your diet?
Yeah, I eat 3 times a day. Eat a lot of vegetables and protein.
That's good.
Yeah.
How much water would you say you drink in a day?
About half a gallon, maybe a gallon.
That's really good. Wow. Can you tell me a little bit about like what your physical activities like?
I work out every day.
Wow, that's really good. And then on a scale of 0 to 10, what's your pain like today?
None. I have no pain.
0?
Yeah, 0.
Okay, good deal. So I'm going to start out with getting some vitals for you.
Okay.
My blood pressure cuff kind of fell on the ground here. Alright, I'm just start by rolling this sleeve up. Sorry, my hands are really cold. I like this tattoo you have here.
Oh, thank
It's
you.
really cute, nice little smiley face and your freckles. How long have you had that?
A couple months.
Has it bothered you at all?
That's too tiny.
It's very cute. I quite enjoy it. Thank you. Alright, it's probably a little cold. Nice and tight around the arm here. Just gonna hang this here. Maybe. Alrighty. Make sure it's on my diaphragm here. All right, your blood pressure was a good 118 over 74. Is that about normal for you?
Yeah, that's pretty normal.
I'd like it to be around or under 180 over 20, or 120 over 80, sorry. That is perfect. All right, I'm gonna get your temperature from you. Maybe. All right, 97.5, that's good. All right, I'm gonna start now by getting your pulse and your respirations from you.
Okay.
Right here, I'm gonna squat down. Need a little cracky. your pulse was about 78 and your respirations were about 16, which are both really good. We like your respirations between 12 to 20. Okay, so those are good. And we want your pulse to be around 60 to 100, so those are both really good.
Awesome.
And then at this time, we normally do a SpO2 on you, but we don't have one here with us. So typically you want that to be around like 95, 97 to 100% on room air. And then I'm going to check for clubbing here, which I see none, which is good. And I'm going to check your capillary refill, and they are both under 3 seconds, which is what we want. So now I'm going to get started on your arms. So first I'm going to roll this sleeve up. Alrighty, I'm just gonna, I'm gonna feel them. Sorry, my hands are really cold. Your temperature is nice and warm. Your muscle tone is nice and even. I'm not seeing any abnormal moles or spots here. I do see you have a tattoo here. Have you had any issues with that?
No.
Alright, good deal. Alright, now I'm gonna feel for symmetry and like if they're bounding for your radial and brachial pulses.
Okay.
So I'm gonna do your radial. They're both nice and symmetrical and bounding. I'll do your brachial. Also nice and symmetrical and bounding. So I'm gonna do some range of motion type of stuff with you now. So I'm gonna have you put your hands out like this for me. I'm gonna have you not let me push them apart. All right, don't let me push them in. Alrighty, go up, and then, yep, and then down. Beautiful. Can you do this for me? All right, and then this. Any pain with any of those? All right, I'm gonna have to make a swimming motion. I'm gonna stick my arms right here. All right, and then go back. All right, and that's checking for crepitus, and I don't feel any. So I'm gonna have you shrug your shoulders for me. All right, so that was testing for cranial nerve number 11, which is your spinal accessory nerve, and then I'm just gonna have you squeeze my fingers for me. All right, good deal. Nice and strong. Now we're gonna move on to your head. So if you take your hair out for me. Thank you, ma'am. Beautiful dark hair. I'll grab it.
Thank you.
All right, so I'm gonna start just by feeling around in your head here, making sure there's no unusual bumps or dents or anything like that. Have you had any dry skin or anything like that?
No.
Any dandruff?
Nope.
Any itching lately?
Nope.
All right, good. I'm not seeing anything. Your scalp is nice. I'm gonna feel your occipital lymph back here. Any pain?
No.
Alrighty. I'm gonna go ahead and do your pre and post auricular. I'm gonna start with your post, which is behind your ear. Any pain?
No.
All right, and your pre-auricular? Any
No.
pain? All right, good deal. So I'm gonna move on to your face. So I'm gonna have you make some faces at me. So this is testing cranial nerve number 7, which is your facial nerve. All right, so go ahead and raise your eyebrows. All right, and then smile, and then frown, and then puff your cheeks out, like chipmunk. Beautiful. Perfect. That's nice and intact. Now I'm gonna test cranial nerve number 5, which is your trigeminal, and I'm gonna have you bite down for me. Beautiful. Now I'm gonna take my pencil here and I'm gonna touch different spots on your face with the eraser of it.
Okay.
And I'm just gonna have you close your eyes and tell me where I'm touching, all right?
Okay. My forehead, my right cheek, my left cheek, my chin.
Beautiful. That's nice and intact as well. So I'm gonna move on to your eyes. Do you have any glasses or contacts or anything like that?
No.
All right, so you see pretty well. All right, I'm sorry, my hands are cold. I'm gonna touch your eyeballs a little more, eyelids, sorry. All right, look down. Okay, look up. All right, so your eyes are nice and clear. Your sclera is nice and white. Your conjunctiva are nice and pink, not irritated, not red, anything like that. So that's really good. So I'm gonna take my little handy dandy pen light here, and I'm just gonna check for your pupillary reflexes, your responses. And I'm gonna do that with direct and consensual. So I'm just gonna shine a light in your pupils a couple times and see if how they dilate and react to another. And I'm also gonna check for combination while I'm at it. So, okay. All right, just keep looking at me. direct and consensual pupillary responses. And now I'm just gonna see your corneal light reflex. So I'm just gonna see how my light reflects off of your corneas. All right, keep looking at me. All right, that's nice. I can see the good reflection. So I'm at it. I'm just gonna have you stare at my pen light for me. And then look at the wall behind me. And then pen light. And wall behind me. All right, that's testing for accommodation. So I see that your eyes have perla, which is your pupils react, are equal, and they are round, and they react to light, and they also accommodate.
Okay.
So that's really good.
Sweet.
So now I'm going to be testing 3 different cranial nerves. So I'm going to be testing cranial nerve 3, 4, and 6, which are ocular, motor, trochlear, and abducens.
Okay.
With your 6 cardinal fields of gaze. So I'm just going to look at my pen and just follow it with your eyes, all right? Not your head. Fantastic. So now I'm going to have you do some cerebellar function kind of things. So I'm going to have you touch your nose with your finger, and then touch my pen, and then nose, pen, nose, pen. Beautiful. All right. So now I'm going to have you make an okay sign for me. All right, and then just flip your fingers through it. Beautiful. All right, now I'm going to have you put your hands like this, and then flip them as fast as you can. Great. Your cerebellar function is amazing. And I'm going to look in your nose. All right, we're just going to make sure it's nothing going on in there. And look back for me. All right, it's nice and pink and moist in there. There's no polyps, no deviated septum or anything like that. So I'm going to go ahead and feel your maxillary sinus right now. Any pain?
No.
All right, and your frontal sinus?
Nope.
No pain? All right. So do you have any problems with smell?
No.
All right, so I'm going to test your cranial nerve number 1. It's the olfactory nerve, so it's just your smell. So I'm going to close your eyes for me. And then take a sniff. What you smell?
Cinnamon.
Beautiful. Alrighty. So I'm going to move on to your mouth. So do you have any false teeth?
No.
Do you have any permanent retainers?
Yes, I have one on the top.
Okay, does that bug you at all?
No.
Alright, no bleeding gums, nothing like that. Alright, and do you still have your own tonsils? I don't know why you would have anybody else's tonsils, but do you still have your tonsils?
Yes, I have.
Alright, how often do you go to the dentist?
Like twice a year.
Alrighty. I'm just going to open your mouth for me. Alright, take a look at your hard and soft palate. Stick your tongue out. Alright, those look good. Alright, so now I'm going to have you stick your tongue out for me and then move side to side. Alright, that tests cranial nerve 12, which is your hypoglossal. Then I'm going to grab my tongue depressor here. Then I'm going to have you stick your tongue out. I'm going to stick this out. Do you have a sensitive gag reflex?
No.
Alright, I'm going to stick this in your mouth and then have you say ah.
Okay.
Alright.
Ah.
Alright, your uvula goes up and down with that. That's fantastic. That is testing your cranial nerve number 9, your glossopharyngeal. And then I'm going to have you swallow for me. Alright, that tests cranial nerve number 10, which is your vagus.
Okay.
Now we're going to move on to your ear. So I'm just going to palpate your pinna a little bit. I see you got some nice piercings here. These bother you at all?
No.
Alright, I'm going to lift up on your pinna here. Look in. Look behind your ear. No redness, no swelling, nothing to be concerned about on that ear. How about these piercings over here? They bother you?
No.
Alright, I'm just going to look it. I'm going to lift it up and in and behind. Great, those look good. Alright, now I'm going to move on to your neck and I'm just going to feel the rest of your limbs, okay? So I'm going to start here with your submandibular. Any pain?
No.
Alright, submental, sorry.
Mm.
No? Okay, and then I'm going to do your cervical chain. Pain?
No.
Alright, and I'm going to have you shrug your shoulders up for me. Alright, this is your supraclavicular. Any pain?
No.
Alright, while I'm here, I'm going to do some tissue turgors, just test how hydrated you are. Went right back down, no tenting, perfectly hydrated, which I would expect with you having a half a gallon to a gallon of water a day. Alright, and then I'm just going to have you turn your head kind of like this for me. This way, sorry. Alright, I'm just going to feel your carotid artery just one at a time here. Alright, Alright, let's feel good. And now I'm gonna also take them, and then when I do it, I'm gonna have you hold your breath, but I'll let you know when so you don't have to hold it the whole time. And I'm gonna do that with my bell.
Okay.
Make sure that's on for me. Alright, go ahead and hold your breath. Alright, you can go ahead and let it go. That sounded nice and clear, no brewing, nothing like that. And again, hold your breath. All right, go ahead and let it go. No brewing or anything like that. It was just like a whistling kind of sound.
Okay.
Something we just don't like, a whooshing.
Mm-hmm.
We don't want to hear that in your arteries. All right, so now I'm gonna have you scoot back a little bit.
Okay.
I'm gonna go ahead and come around to your back. While I'm here real quick, I'm just gonna check your thyroid right here. Palpate it. Any pain?
No.
All right, good deal. So I'm gonna check out your skin back here. So you got a mole right here.
Mm-hmm.
Have you had that checked out?
Yeah, I have.
All right, nothing to be concerned about, I don't think.
No.
All right, good deal. So your skin looks nice. I'm just gonna see your spine. Sorry, that's nice and straight. All right, so now I'm just going to, percuss your lungs. I'm gonna do it 12 total times, 6 on each side.
Okay.
So, all right, I'm gonna start right up here. Oh, sorry, first, I'm gonna do your 2-to-1 ratio and your lung expansion.
Oh, okay.
So I'm gonna put my hands right here, sorry, they're really cold. I'm gonna have you breathe in for me. Beautiful, nice expansion. All right, I'm gonna feel right here. And then I'm gonna feel right here and right in between your breastbone here. All right, you have a nice 2-to-1 ratio. So we don't have to worry about barrel chestedness or anything like that, which is something that we worry about with people with COPD.
Okay.
And yeah, so now I'm gonna go into percussing your lungs. Again, it's gonna be 12 times in total. So. Go right under your bra here. All right, I'm hearing resonance with that, so that's what we want to hear. I'm gonna go ahead and listen to them, so I'll have you take some deep breaths for me.
Okay.
And again, it's just gonna be 12 times. I'm gonna listen to this with my diaphragm. All right, go ahead and take a deep breath in and out. Again. 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 And again. And again. All right, I'm gonna go right under your bra here. And again. And on the other side, under the bra again. Again. All right, 2 more times. And last one. All right, are you feeling dizzy at all after that?
No.
All right, good deal. Those sounded nice and clear. Nice, good breaths.
Awesome.
All right, now I'm gonna have you lay down for me. Come around here. I'm gonna take this pillow off from under you real quick, just so I can check for JVD, which is just jugular vein distensions with your vein right here, making sure it's not popping out or anything. All right, have you turn your head this way for me? Nothing there, other way. All right, beautiful. All right, we can go ahead and put this pillow back under. Yeah.
That's okay.
Okay. All right. So I'm gonna go ahead and listen to your heart now.
Okay.
So would you mind if I brought this down?
No, go ahead.
Is that comfortable for you?
Yeah.
Alrighty, just right there. So I'm gonna start here with your aortic, which is 2 intercostal space down on the right. So 1, 2, and I'm gonna listen with my diaphragm, and then I'm gonna switch it over to my bell to make sure there's no murmurs. All right, and switch it to my bell. All right, that sounds good. A nice lub dub. And I'm gonna go over here to the 2nd intercostal space on the left, which is your pulmonic. 1, 2. All right, I'm gonna switch it over to my bell. All right, and I'm gonna go down to the 3rd intercostal space, which is your herbs. So this was 2. 1 down is about right there. Oh, sorry, diaphragm first. That's a beautiful heartbeat, nice lub dub. No murmurs there. And now I'm going to go down to the 4th intercostal space, which is your tricuspid, which is going to be about mid-clavicular right there. Start with my diaphragm here. All right, and over to my bell. All right, and then last one, we're gonna go over to your 5th intercostal space down. It's gonna be right there. All right, thank you. And I'm gonna listen to this for a minute with my diaphragm, and then I'll listen to it with my bell real quick. This is just for your apical heart rate. All right, that sounded good. I got about a 78 for your apical heart rate. I just gotta listen to it with my bell real quick, just to make sure there's no murmur right there. Flip that over. All right, no murmur there, beautiful. All right, we can go ahead and pull this up for you. Now I'm gonna start with my abdominal assessment. Can I pull this up?
Go ahead.
All righty. This step right there is perfect. All right, so I'm gonna start by getting level with your stomach, thank you, and inspecting just to make sure there's no any unusual lesions, lumps, anything like that, anything. We don't want to see if you got your belly button pierced that have any issues for you.
No.
Oh, excuse me again. How long have you had it?
About a year and a half.
Yeah, I've had mine for like a year. I love it.
It's just so cute.
It is. It makes you feel so much better. All right, so I'm gonna start by listening to your bowels, and I'm gonna start in the right lower quadrant. When was the last time you ate?
A couple hours ago.
Alrighty. So I'm gonna go ahead and give her a nice listen here with my diaphragm. We're gonna start down here. All right, got about 5 gurgles there. Let's go up to the upper right quadrant. All right, 5 gurgles there. Go over to the left upper quadrant. All right, 5 gurgles. Go down to the left lower quadrant. All right, I'm hearing some hyperactive bowel sounds. Oh, excuse me, thank you. All right, so that's good. That makes sense since you just ate a couple hours ago that your bowels will be hyperactive. So now I'm gonna go ahead and use my bell here that I just switched to and listen to, do a little bit more of a cardiac assessment down here. So I'm gonna start with your aortic. All right, go into your renal. And your other renal. And your iliac. All right, I'm gonna have you hike your shorts up a little bit for me so I can get to your femoral. It's gonna be right here. All right, and the other one. All right, that all sounds good. All right, so now I'm gonna percuss your abdomen. I'm gonna do about 3 different taps in each quadrant. So we're hoping we hear timpani here.
Okay.
So I guess we'll find out. Sorry. All right, I'm hearing timpani there. So I'm gonna go ahead and go up into your liver.
Okay.
Make sure that's dull because it's an organ instead of timpani where it's gonna be down here. All right, that's a little more dull up here, so that's where your liver is. All right. So now I'm going to do some palpation on your abdomen. So you just let me know if you have any pain at any time.
Okay.
And I'm gonna start with light palpation.
Okay.
No pain?
Mm-mm.
All right. Still nothing?
Nothing.
Any pain?
Nope.
All right, good deal. So now I'm gonna go ahead and go into my deep palpation.
Okay.
Same thing, just let me know if you have any pain. No pain anywhere?
Nope.
All right, that all feels good. So we're all done with your abdomen. So I'm gonna put this back down for you. Now we're gonna go ahead and move over into the legs. So I'm gonna start with inspecting them for edema, any lesions, things like that. Is this a birthmark?
Yeah.
Haven't changed shape or grown or anything?
No.
All right, good deal. I'm not seeing any dimpling, so there's no edema or anything like that. It looks pretty good. You're nice and warm. All right, I'm gonna have you take your socks off of you. All right, so we're gonna go ahead and palpate some pulses. I already listened to your femoral, but I'm gonna palpate that now, so I'm just gonna hike up your shorts a little bit. All right, I'm just gonna go right in here. All right, those feel nice and symmetrical. Now I'm gonna go into your popliteal. Have you bend your knees a little bit for me? Those are nice and symmetrical. Now I'm gonna go into your posterior tibialis. Those are nice and symmetrical. Now I'm gonna go ahead and do your dorsalis pedis. All right, that's nice and symmetrical as well. While I'm down here, I'm gonna go ahead and do your cap refill. Those are nice and under 3 seconds, which is what we want. And while I'm over here with your feet, I'm gonna do some range of motion. So I'm gonna push down my hands like a gas pedal. All right, push them up. All right, push them out in. All right, push them out. All right, beautiful. I'm gonna grab my fork here and we're gonna do some sensory perception.
Okay.
So this is going to be sharp and this is gonna be dull.
Okay.
All right, so just close your eyes for me and let me know where I'm poking and if it's sharp or dull.
Okay. Right shin sharp.
Mm-hmm.
Left quad dull. Right quad dull. Left shin sharp. Top of my left foot dull. Top of my right foot dull. Bottom of my left foot dull. Bottom of my right foot dull.
Perfect. All right. So now I'm gonna go ahead and have you swing your legs over here for me as you sit up. All right, you feeling dizzy at all?
No.
All righty. So I'm gonna have you uncross your legs for me and scooch up just a little bit more. But all right, so I'm gonna check your patellar reflex.
Okay.
All right, those look nice. All right, and then while I'm gonna have you swing your legs out for me. All right, this is just checking for crepitus. I don't feel any, so that's super good.
Okay.
All right, I'm gonna hand you your socks and shoes. I'm gonna have you put those on so we can do 2 more tests. And we're almost done.
Okay.
So first I'm gonna do your Romberg test. So that's gonna test cranial nerve number 8, which is your acoustic, which is just for your balance.
Okay.
Put your shoes on. You need help or you got it?
I got it.
Alrighty. And then after that, we're just gonna test your gait.
Okay.
This is just your walking and stuff like that. So we're gonna start out with the Romberg. We're gonna have you stand up for me. Feeling dizzy at all?
Mm-mm.
All right, we're gonna have you close your eyes and put your arms out at your sides. Just hold it here for a couple seconds. All right, that's good. All right, you got a negative Romberg, which is good. Again, that tests cranial nerve number 8, which is your acoustic.
Okay.
And so since you're the negative Romberg, we can go ahead and test gait.
Okay.
So we're gonna have you walk with me, just straight up a couple feet. All right, and then we're gonna turn around and walk heel to toe for me. Beautiful, go ahead and sit back down, that's great. So based on today's assessment and your history and a bunch of questions that I asked you, I'm not seeing any moisture, shear, friction, anything like that. Your nutrition's really good, your activity's really good. So I'm gonna go ahead and give you a 23 out of 23 on your Braden scale.
Perfect.
I'm just gonna check my sheet real quick, make sure I didn't miss anything. Alrighty, I think that's it.
Okay.
Welcome to the clinic.
Hey, thank you.
My name is Rachel. I'm a nurse practitioner student. How can I help you today?
Yeah, I'm just here for a physical.
Okay, great. We can do that for you. I'm going to start with my hand hygiene.
Okay.
All right. So, patient appears healthy. Posture is erect. Normal height and weight for age. Appears alert. No distress, mood, and affect are appropriate for situation. Can you tell me your name and date of birth, please?
Kai and August 24th, 2001.
Great. Okay. And funny question, where are you right now?
In a building.
The clinic.
There we go. Okay, clinic.
In the clinic?
In the clinic.
Uh-huh. And what year is it?
It is 2024.
Okay. So patient is alert and oriented and speech is clear. We're moving on to skin now. Skin is normal for ethnicity. No obvious rashes, lesions, no open wounds, no concerning things at all on the skin. So now I'm going to touch your skin. Skin is warm and dry. We're going to check skin turgor. I'm going to pinch right here. No tinting. So I'm going to look at your nails. Nails are pink and round, and capillary refill is less than 3 seconds. Okay, moving on to your head. Head is normal cephalic, meaning it's a normal shape.
Oh, that's good.
All right, next I'm going to touch your scalp, okay? So scalp is clean, no lesions, no infestations. Is it tender when I touch your scalp?
Mm-mm.
No? Okay. All right, so I'm gonna have you close your eyes and then open them back up again. Smile real big. Okay, we're down. Great, okay. So next I'm gonna do a Q-tip test. This is not a Q-tip, but we're pretending it's a Q-tip. Close your eyes and you're just gonna tell me where I'm touching you, okay?
Mm-hmm.
All right,
Forehead. Right cheek.
perfect.
Left cheek.
Okay,
Chin.
great. Okay, now you can open your eyes and then puff out your cheeks really big. Great, and then I'm gonna push on your shoulders. I'm gonna have you raise them against resistance. Yep, and the same thing, you're gonna open your jaw against resistance. Perfect, okay. So cranial nerves 5, 7, and 11 are intact.
Yes.
Okay, next I'm gonna look at your eyes. So I'm gonna touch your face again. I'm gonna pull down on here. So conjunctiva is nice and pink. Sclera is white, non-ejected, anictoric. I'm going to look at your pupils now with this light.
Mm-hmm.
So you just look straight ahead, and then shine a light in your eye. Yep. Look around the other side. Yep. Great. So your pupils are nice and reactive. So next, if you could look at my pen,
Mm-hmm.
and then look over my shoulder, and then look at my pen, and then look over my shoulder, and then look at my pen again. Great. So you have good accommodation. You're gonna keep looking at my pen,
Mhm.
follow the pen, but don't move your head. Okay.
Mm-hmm.
Great. Okay. Very good. All right, we're done with that part.
Beautiful.
Next, I'm going to stand behind you,
Mm-hmm.
and you're going to tell me when you see my finger, okay?
Okay.
And then we're just testing your peripheral vision with this. Do you see my finger?
Yes.
Okay.
Now I do. I was like, as soon as you said that, I did.
All right, great. And just still looking straight ahead.
Yes. I see
Okay.
it. Okay, I see it.
All right.
And I see it.
Okay. All right, so cranial nerves 2, 3, 4, and 6 are intact. Next, I'm going to look at your eye with an ophthalmoscope. That's this thing right here.
Mm.
I'm going to turn the light on. All right. Okay, so you're going to look over my shoulder.
Mm.
I'm going to shine the light at your eye first. We're going to get really close to each other for a little bit, and then I'll have you look at the light in a minute.
Beautiful.
Okay. All right, so looking over my shoulder, fixed point. Good, red light reflex. Okay, this is the part where I get kind of close. Look it in your eye. I do see your retina. I'm going to change the setting and see if I can see some more. All right, I see your retina. Not getting a good object visualization, but go ahead and look at the light. I do see a good macula there, so that's good. Okay, so same thing on the other side. So looking over my shoulder.
Mhm.
Now I'm gonna look with my left eye this time. There we go. All right. Good. Red light reflex. Can see retina. Oh, I can see veins there. Still not really seeing an optic disc though. Go ahead and look at the light. Okay, great. Macula visualized.
Isn't it so? You sound different when you're on this side of my. Isn't that? That's so weird. I was like, why does she sound different? That was crazy.
Maybe because I'm
Maybe
doing my
I'm
face
not even
mirror.
squinting
I
more.
don't know.
That actually was super strange. So I was like, why does she sound different? If
Okay.
anything.
So, next I'm going to do your ears. Oh, hold on. Go ahead and hold on to this. So,
Mm.
looking at your ears, they look great. They are symmetrical. Not seeing any drainage externally, no redness or swelling. So I'm going to go ahead and actually, let me put this down. I'm going to touch your ears first. I'm going to press on your tragus. You have any pain when I touch there?
No.
Okay. And then this is your mastoid process. Any pain back there?
No.
No? Okay. All right, and then I'll go ahead and do whisper test.
Mm-hmm.
So I'm going to come over to your left side. I want you to cover your right ear.
Of course.
I'm going to say something, you repeat it back, okay?
Mm-hmm. 44.
Okay. Now we're going to do it on the other
So
side.
So
Okay.
nervous.
Yep, cover your ear. Same thing on this side.
55.
Great. Okay. So cranial nerve 8 is intact. And
Beautiful.
then now I'm going to look in your ears.
Mhm.
All right. So I am pulling up on her ear, looking into external auditory canal with the light on. Okay. All right. So canal is nice and clear. Just some scant cerumen. No obstruction, no foreign bodies. Tympanic membrane is nice and pinkish gray and translucent. I can see her bony landmarks, and cone of light is at 5 o'clock. So same thing on this side.
Mhm.
So I'm gonna look in your ear, I'm gonna look on that. All right. So canal is nice and patent. There's a little bit of cerumen in here, but otherwise it's clear, nice and translucent tympanic membrane. It's pinkish gray. Do see those bony landmarks, and the cone of light is at 7 o'clock. So that's great, and we're done with your ophthalmoscopic exam.
Yay.
Okay, so next, just looking at your nose, I'm
Mhm.
gonna actually hold on to this. Nose looks good, nice and pink, no drainage externally that I can see.
I'm not sick.
I'm gonna look up there. Okay, great. So no deviated septum, mucosa is nice and pink, no drainage. Let me get up a little bit of there. Okay, over on this side. Same thing, mucosa is nice and pink, no drainage. I'm gonna push on your sinuses now.
Mhm.
So this is your frontal sinus. Do you have any pain right there?
No.
Okay, and then what about maxillary sinuses?
No.
Okay. All right, so next we're gonna look in your mouth. So your lips are nice and pink, no lesions, no sores, no cracking or anything like that. Next I'm gonna have you open your mouth. Yep, say ah. Great. Okay, so mucosa are pink, teeth look great, no obvious dental caries, are all intact. Say ah again for me. Okay, oropharynx is pink, it's not injected. One more time. Tonsils without exudate, and they're like grade 1. Yay. Okay. So then I'm gonna push on your jaw, okay? And you just tell me, do you have any pain there?
No.
Okay, and open and close your mouth a couple of times. Great. No clicks. That's awesome.
Mhm.
And then next we'll take a look at your neck. Actually, I'm going to have you stick your tongue out, move it back and forth.
Okay.
Ah.
In my mouth or out of my mouth?
That's good.
I'm making scary faces at you.
All right. Next is your neck. So your neck looks great. Just look to your right and then to your left. I'm not seeing any jugular vein distension. Okay, wait, I didn't finish. I'm going to hold your throat for a second when you swallow. There you go. And then say light, tight, dynamite.
Light, tight, dynamite.
Did not finish my cranial nerve assessment for my mouth section,
Mm-hmm.
but that is cranial nerves 9, 10, and 12.
Beautiful.
Okay, now I looked at your neck, looked at regular vein distension.
I looked right and left.
Mm-hmm. Okay, next I'm going to listen to your carotid arteries.
Mm.
So same thing, I'm going to have you look to your right, and you're going to take a big deep breath, and then I'm going to listen to your carotid artery for a minute,
Mm.
and then, not a minute, you don't have to hold it that long. Just for a couple of seconds, okay?
Mhm.
All right, so big deep breath, and then hold it. Okay, that's great. Carotid artery without bruit. Same thing on this side.
You may look to the left.
Yeah. Big deep breath in and hold it. Great. All right, no bruit. Now I'm gonna come around and I'm gonna feel on your thyroid gland. I think this is gonna take me sitting behind you.
Okay. A little crisscross applesauce.
Yeah, just fine. I'm actually gonna keep your hair right
Okay,
here.
okay, sorry.
I'm gonna find your thyroid gland. Yep. Okay, so now look down into your left. There you go. Okay, and then down into your right. There. Okay, your thyroid gland is nice and firm.
Yes.
I don't feel any nodules. Okay. And then next is, let me do lymph nodes. Okay. So you have a bunch of those. I'm going to feel just a few of them. So this is your pre-auricular and post-auricular. And you tell me if you have any tenderness in those areas, okay, when I'm pushing.
Nothing yet.
Occipital. Okay, and then tonsillar. And submandibular. And then submental. Okay, no tenderness at all? Okay. And then anterior cervical chain. Might actually have a little one right there.
Really?
Just a little bit swollen, but not tender.
It doesn't feel tender.
Okay. Same thing maybe right there.
I
Okay,
felt
and
it
then
moving a little bit more when
Yeah.
you touched this one though, yeah.
posterior cervical. Okay, and then supraclavicular. All right, so no tenderness anywhere. Okay, just maybe a little bit swollen in your like submandibular.
This right here.
And then the anterior cervical ones.
Yeah.
Okay, all right.
Uh-oh.
Could be nothing. Could
Right.
be you getting sick. Could be you getting over something.
Yeah.
Okay, so next I'm gonna listen to your heart sounds. All right. So this is your aortic. Yeah, and you're doing great. Just keep breathing normally. Pulmonic. Herb's point. Okay, and then we got tricuspid. I'm just going to go with under a little bit right here. And mitral. Okay, sounds great so far. Good. S1, S2 sounds. Now we're going to listen for a murmur. Use the other side of my stethoscope and same thing again. So aortic. Pulmonic. Okay. Herb's point. Tricuspid. And mitral. Okay, very good. So still good S1, S2 sounds, no murmurs. Now we're going to listen to your breath sounds on the front, then I'll go to the back and we'll do a few things back there. Okay, so you're just going to breathe in deep and out. Very good. I'm listening to the upper lobes, that's right upper and left upper. Right upper again. Left upper again. Okay, and then right middle. Left upper. Right lower. And left lower. Awesome. So breath sounds are nice and clear anteriorly. Your no respiratory distress, symmetrical, good excursion, and then we're gonna come around. Then yeah, do it this way again. Do a couple things back here. So breathe in. Okay, same thing. Upper lobes, right upper as well. Left upper. Right middle lobe. Left lower lobe. Right lower lobe. Okay, and left lower lobe. Okay, breath sounds are clear back here too, that's great.
On the right, did you hear my spine pop whenever I breathed?
No.
Like, inhaled and it went pop.
Okay. Got you a little adjustment too.
Yeah, right? My gosh, a chiropractor as well.
All right, so the next thing that you're gonna do is every time that you feel my stethoscope touch your back, you're gonna say 99.
Okay.
All right, so
99. 99. 99. 99. 99. 99.
okay. So that was muffled, which is good. That's how it's supposed to be.
Oh, cool.
Okay, next we're going to test for tactile firmness. So I'm going to touch your back, just like I did a few minutes ago with my stethoscope, and you're going to say 99 again, okay?
Okay.
All right, go ahead.
99. 99. 99. 99. 99. 99.
Okay, great. So no tactile firmness. And then now I'm going to tap on your back, okay? All right, so another thing that I have to hit on is your crossovertebral angle, which is right here. Oh, and those sounds were resonant.
By the way.
Yeah. So crossovertebral angle is right here. That's we're testing for pain over your kidneys. I'm just going to kind of punch your kidneys, okay? Right. Anything?
No.
Okay. Nothing?
No.
Okay. And then lean forward, curving your back, and I'm just gonna make sure your spine is straight. Perfect. Your spine's nice and straight.
Yay.
Yay.
My mom has scoliosis. Did you know that?
No, I didn't.
Mm-hmm.
Well, you do not.
I win. I win the genetics.
Okay. So now I'm gonna have you get up onto the table. You can keep your feet in the chair, but your butt right here.
Cool.
So first I'm just gonna take a look at your belly. I don't see any hernias, any scarring, no distension, contour is nice and flat, okay? Then I'm gonna listen to your belly, starting in your right lower quadrant. Thanks.
You're welcome.
I'm just listening for bowel sounds. And you're hungry.
I felt it. I felt the growl.
Pretty hyperactive in the right lower quadrant at
That's
least.
funny.
Normal active there. Now we're in left upper. Left lower. Okay. So I would say normal active bowel sounds overall.
I thought meant hunker.
I don't know. It's definitely making a lot of noise down there. Okay, so next I'm going to tap on your belly like I did on your back, okay? So it should be kind of dull, but right there over your liver. No. Nice and dull there. Yeah. Yeah. So, tympani heard everywhere except for over your liver, which is dull.
Is it normal for over my belly button for that to have felt a little sensitive whenever you did that?
No.
It
I
did.
didn't hit, so right here maybe?
Like
Okay.
right over my belly button, kind of.
Up higher. I was gonna say
Yeah.
I didn't do it like with my fingers over your belly button.
Yeah.
I'm gonna push on your belly now. I'm gonna
Okay.
push lightly first and we'll see if that hurts. Okay. So start maybe over where you're not hurting.
Yeah. So like when you push right there, I feel it right above my belly button.
Interesting.
Is that weird?
Have you had any vomiting or diarrhea or any pain
No,
at all?
not recently. But sometimes I will have weird little pains, which I probably should, really,
You
really
should go
check
see
out.
maybe a real provider for that. Okay, so no pain
No, not around.
necessarily. Okay, but then what about when I push there?
It just, I feel it differently than whenever
Okay.
you like press on these other areas.
Okay. Well, then I'm going to do a Murphy test. I'm going to push down on your belly and I'm going to have you take a big deep breath in. Open your right upper quadrant. Does that hurt at all?
Mm-mm.
Okay. Murphy sign's negative, so probably not your gallbladder.
Okay, thank God.
Now I'm going to see if I can feel your liver. So I'm going to press up, trying to push your liver kind of forward for me to feel it. It's pretty common for a super healthy young person not be able to feel much of it, but I can kind of feel like the lip of it right here, and that's great. Okay, and then we'll see if we can feel your spleen. No, that's right. No hepatosplenomegaly, and just like a weird feeling there, not pain.
Yeah, not pain, just
Okay.
like I feel it again differently than whenever you're touching on the sides.
Okay. All right, sit up for me. We're gonna do your musculoskeletal test now. All right, so I'm gonna have you put your arms up. There we
Sorry.
go. That's okay. Pull and then push. Great. And then arms down. So strength is 5 out of 5. And feel pulses. Okay. Pulses are good. 2 plus equal. All right. Now we get to do the fun reflex test. Okay. So we'll do your bicep tendon reflex first. And push right there. Yep, we're having good reflex there. And here. Okay, and then we'll do your tricep reflex. Relax your arm. Yeah, there you go. Nice little swing with your hand. Okay, and then turn your hand over. This is brachioradialis. We're doing 3 inches above your wrist. Have a little thumb twitch. Okay, great. Same thing on this side. We can start with brachioradialis on this side. Yeah,
Oh,
that was good.
wow.
One. Okay.
This
and
side of my
then
body is way more
triceps, see if
reflexive.
Okay, and then just relax your arm. Yeah, good job. Okay, and then find your bicep tendon here, and then yeah, I can feel it. I don't know if you can see it with
See
the
it as
camera,
much?
but these two are flexing.
Okay.
Okay, great. So
I feel like I
reflexes
win
are
something
good.
every time. I'm like, I feel like I did something, but I didn't do anything.
You did great. Okay. So next we will do your reflexes on your lower legs since I still have a hammer. So this is going to be your patellar reflex. Nice. I'll do this one too. Okay. And then next is your Achilles tendon. I'm going to flex your foot and see if we can get a little bit of a twitch there. Okay, same. And you don't flex, I flex.
Oh, sorry.
It's okay. So relax your foot. Yeah. Got a good twitch there.
Got on
Okay.
that side.
Okay, and then pull against my hands and push. Great, and you have no dependent edema on your legs, no peripheral edema. And then I'm gonna just feel your pulses, your dorsalis pedis. Okay, and those are equal and 2 plus. All right, arms like this. Okay, do your wrists like this. Good range of motion. Okay, same thing with your legs. Put one leg up and down. Yeah, down. Do your ankles. There you go, turn them. Perfect. Okay, so you got full range of motion. I'm gonna have you stand up. Do your neck does okay. Full range of motion, neck too. Great. All right, so
I'm telling you, a chiropractic appointment is what's happening.
walk towards the camera.
I crack way too
Okay,
easily.
and then walk back. Okay, now stand in front of me right here. Close your eyes. I'm gonna put my arms out just in case you feel like you're gonna fall. Let me know. Let me know if you feel